You finally get the referral, you call the specialist's office, and the first available appointment is 3 months out. The doctor exists, their office is right there across town, lights on, seeing patients all day. So why can't one of those patients be you this week? Here's the surprising answer. The wait usually isn't only about a shortage of doctors, it's about a shortage of something much more specific. Open slots on a calendar that's already full. A specialist's office is a queue, and you just joined the back of it. Consider one documented example. In a 2022 study, researchers posed as new patients and called 948 psychiatrists across 5 states. Only about 18% were taking new patients at all. And among the ones who were, the median wait for an in-person appointment was 67 days, more than 2 months. This was mental health, where the crunch is worst. But the same machinery, full calendars, closed doors, shapes the wait for almost every specialty. To see why, you have to look at how a specialist's time actually gets divided up. So let's answer it like an operator. Why does seeing a specialist take months, even in a city full of them? The answer isn't a simple headcount problem, it's a queue, a fixed number of appointment slots each week, a huge backlog of patients already in the system, and a steady stream of new referrals arriving faster than the slots open up. Understand the queue, and the 3-month wait stops being a mystery. First, the trend. In a 2025 survey of doctors' offices across 15 major cities, the average wait for a new patient appointment was about 31 days, a full month. And it's been climbing, up almost 20% in just 3 years, and nearly 50% since 2004. Now, this is a staffing firm's survey of selected big cities, not a national random sample. But within those cities and specialties, the direction is clear. The measured wait is climbing. And for some specialties, it runs well past a month. A new obstetrics appointment in that survey averaged 42 days, and in some cities, a first opening is 2 to 3 months out. It's tempting to blame a doctor shortage, and there is real debate about whether we have too few. We'll get to that. But it isn't the whole story, because even where specialists are plentiful, the waits are long. The tighter bottleneck is time. A specialist has only so many appointment slots in a week, a fixed service rate, and those slots get claimed by 2 groups at once. The flood of new patients being referred in, and the existing patients coming back for follow-ups. When demand for slots runs up against a fixed supply of them, a line forms. That line is your wait. And here's the counterintuitive part. It's the same math as a full highway or a checkout line. As a specialist's calendar fills toward 100% booked, the wait doesn't rise in a straight line. It curves upward hard. A calendar that's 70% full has a little slack, so a new request gets seen soon. At 90%, the wait is several times longer, pushed to 98% booked, which is exactly how a busy specialist runs, and it balloons. To be clear, those are illustrative numbers, the shape of the math, not a measured figure. But it's why running a clinic at full capacity, which looks efficient, quietly produces months-long waits. So the calendar stays nearly full, and the line never really clears. The next question is what keeps it that way. And there are a few forces, each of which quietly adds days to your wait. Start with the referral funnel. You don't usually just walk into a specialist. Your primary care doctor refers you, and a single specialist is the destination for referrals from dozens of primary care doctors across a whole region. So demand gets funneled. Many wide doors upstream, pouring into a few narrow doors downstream. Every one of those referrals joins the same queue you're in. The specialist isn't ignoring you. They're working through a backlog fed by an entire community's worth of primary care. Then there's geography. Specialists cluster in cities near the big hospitals, so in much of the country, the nearest one is far away and overloaded. One 2024 study found that nearly half of all US counties, home to about 22 million people, have 0 practicing cardiologists. Not a long wait, 0. For those patients, the queue doesn't just run long, it starts an hour's drive away. Maldistribution turns a national average into a local crisis. And where you live can swing the wait wildly. In that same 15-city survey, the average new patient wait in Atlanta was about 12 days. In Boston, a city famous for its hospitals, it was 65. More doctors per person doesn't automatically mean a shorter wait. Sometimes the busiest, most prestigious systems have the longest lines because everyone wants in and the calendars stay jammed. Same country, same specialties, 5 times the wait. Inside the clinic, a few more pressures shape the calendar. First, follow-ups. Existing patients hold recurring slots which squeeze out new appointments like yours. Second, no-shows. Patients who book and don't come waste that fixed capacity entirely. Clinics fight back by overbooking, a band-aid that protects throughput but can make the day of your visit chaotic. And fourth, insurance friction. Before some visits can even happen, the office has to get the insurer's prior authorization, a paperwork step that adds a delay of its own. Every slot is fought over before you ever get one. That last one deserves a number. In a 2024 survey by the Maine Physicians Association, which, fair to note, is actively lobbying to reform this, 94% of doctors said prior authorization delays their patients' care. The average office is grinding through around 43 of these insurance approvals every week. To be precise, this is a delay to care and treatment broadly, a different kind of wait than the appointment queue itself, but it eats the same staff time and lands on the same patient. The queue isn't just long, the whole path is full of friction. And the demand side is only growing. The line is getting longer, not just because slots are scarce, but because more people are joining it every year. By 2030, about 1 in 5 Americans, 20%, will be 65 or older. That's the age when you start needing cardiologists and dermatologists and orthopedic surgeons the most. So exactly as the population that needs specialists surges, the number of appointment slots stays roughly fixed. Rising demand against flat supply, the queue mechanics all but guarantee the wait grows. And a lot of the country starts from behind. By the federal government's own count in 2025, about 92 million Americans, more than 1 in 4, live in a designated primary care shortage area. Now this is about primary care, not specialists directly. It doesn't shorten the specialist's line, but it lengthens your total journey to care. First a wait just to find the primary care doctor who refers you, and only then the specialist wait we've been describing. The delays stack end to end. It's worth zooming out, because this isn't unique to America. It's what every health system does with a fixed supply of specialist time. In an older 2016 comparison, about 6% of US patients said they'd waited 2 months or more for a specialist, versus around 30% in Canada. One honest caveat: every survey in this story measures the wait a bit differently. A secret shopper call, a front desk estimate, a patient's memory. So these numbers aren't apples to apples, and I'm using them to show the shape, not to rank systems to the decimal. But the lesson holds: different systems ration the wait differently, through price, through insurance, through queues, and every one of them rations it somehow, because none can conjure unlimited specialist hours. The wait is a design choice as much as a shortage. Which brings us back to the doctor shortage question. One camp, including the Association of American Medical Colleges, projects the country could be short anywhere from 13,000 to 86,000 physicians by 2036. Notice that range. It's a projection, and its high end is 6 times its low end, because it rests on assumptions no one can pin down. The other camp argues the deeper problem isn't the raw number of doctors, it's how they're distributed and how their time flows. Both can be true. But for your 3-month wait, the flow problem is the one you're actually standing in. So can any of this be eased without simply cloning more doctors? Partly, and the most studied fix is boring, and it's about scheduling. It's called advanced or open access scheduling. The old model books everything weeks in advance, so a backlog is baked in from the start. Open access flips it. Keep part of each day deliberately open and see today's demand today instead of pushing it a month out. One large primary care system that adopted it raised the share of patients seen by their own doctor from about 55% to 75%, and shortened delays there, with no new physicians hired. 2 honest caveats. The strongest evidence is in primary care, not specialty clinics, where it's harder, and it only works if a clinic's demand and capacity are already roughly in balance. You can't schedule your way out of a genuine shortage of hours. It's not a cure. But it proves the wait is partly a design choice, not only a head count. So put it together. You wait weeks, and for many specialties months, because a specialist has a fixed number of slots and a nearly full calendar, because referrals from an entire region funnel onto a few doors, because follow-ups and no-shows and insurance paperwork clog the schedule from the inside, and because the population needing care is growing faster than the slots are. In plenty of places, the doctor really is right there across town. Whether the country also needs more doctors is a real debate, but the piece you're actually standing in is the open slot and the way we've chosen to hand them out. If you want the operator's view of how healthcare actually works, the systems behind the headlines in plain English, the breakdowns are at shanewelter.com/free. Next question in this series. When you call 911, why does the ambulance sometimes drive right past the hospital that's 5 minutes away to one that's 30? The answer is about what a hospital is actually equipped to do,